Probably YouTube, which is my first time doing it. Looks like everything good to go. So here we are, and I'm going to introduce myself first. Let's see. Give me 1 second. I just want to check everything is good to go. Good to go. Yes, perfectly fine. Awesome, awesome. So, hey everybody, I hope you can hear me. If you can hear me, give me thumbs up. If you can see me, give me thumbs up. So that give me idea that everything looks good from my end, and I can start right away. And I'm going to hit the record button because last time I did the whole recording and then I forgot to hit the record button, and then somebody asked me like, hey, I want to see it. And finally, I mean, thank God Facebook and TikTok actually recording this, so I was able to get it. So with saying that, people who don't know me, my name is Alpesh. My full name is Alpesh Patel. I'm being licensed physical therapist last 15 years. I'm practicing in New York, New Jersey neighborhood. I have seen all kind of patients starting from 4 month old to almost 101 year old, and I see all kind of a patient population as well as a lot of conditions. Like you have orthopedic conditions, neurological condition, any. So it's like more generalized physical therapies. I've been doing it for a while. Why I'm here? Because my mission is to help 100 million people to be pain free, and that mission starts here live with you guys, interacting with you and trying to help you any way I can. So that's the whole idea about coming to this kind of a live and interact directly one-on-one with you. Feel free to ask many questions. I will time and time I'm going to check all the chat box. So if you see me looking at all different direction, it's not that I'm like kind of diverting. I just have multiple screen on and I want to know if somebody asks any questions on any other places. So here am I. So today's topic, before we go, some of the announcement I want to make it. I know we were last time, I think I didn't make announcement till almost till end. So I'm going to make it up front. The pain cream I was talking about last week, I started like kind of trying it. So I first of all tried on myself. I tried on a couple of my friends and actually 2 patients I tried. So far, so it's kind of almost like 70-80% positive feedback. The 20% is from me again, because if something I don't like, I would never kind of give it to my patient. So far I got like pretty good feedback. The one thing I didn't like is a little bit oily. So when you like, so as a therapist, it's perfectly for me. But again, this is not for therapists. This is for like a mass general population, especially you guys who are suffering from pain. And I don't want you to get that oily feeling. So when you massage your body, it should kind of penetrate right away. Now, if I'm massaging somebody, I would love that oily feeling. So my hand slides pretty good, and then soft tissue mobilization I can do perfectly okay. But again, because I'm a professional and I need to do pretty longer time, but as a patient, probably you won't have that much time, like an hour, 2 hour, or even like 10 minutes massaging your own body, right? Or even somebody, your loved one. So I'm trying to figure it out. If we can get rid of that oiliness at the end, that will make the cream perfectly fine. The second thing I didn't like was it takes a while to get heat up. So the main purpose of that lotion is like kind of make you feel a little bit hot and cold cream, like a biofreeze icy hot kind of that stuff. But again, this is all organic. So this is about organic ingredient we use in this cream, right? So I want to make sure that we use properly ingredient. And so far, so like I said, it's 70-80% perfect. I still need to work on 20%, which I'm gonna figure it out as we go. So hopefully we'll have some more update. The second update is my newsletter, which we launched like 2 weeks ago, and 2 emails has been out already. If you guys interested in the newsletter, my bad, newsletter, just let me know and I will have it on your way. To be honest, that newsletter is a gold mine, because I only share like a solid gold information about your body, about your health, about the exercises, your daily living, something like stuff. So if you guys interested in that one, and I promise you there is no other links, I'm not gonna send you, I'm not gonna sell you anything. So those Saturday, its name is the weekend wellness, the newsletter name is, means your pain doesn't know that it's weekend, it hurts whenever it wants, right? So on the weekend is the one when you guys kind of a little bit rest, your mindset is a little bit calm down, you kind of enjoying the weekend after the whole week, or things settle down, in other words, right? So I want you to have like more something to read on the first thing, like a Saturday morning. So I think it goes out earlier in the morning around 8:30, 8:15. I have to check the time again, I'm working on it on that area as well. But check it out if you guys really like the newsletter. And like I said, it's absolutely free, and there's no marketing, no advertising, nothing like that. It's strictly information only, and you're gonna love it, all those information. So yeah, with saying that, let's move on. So recently one of the patient asked me questions about hey, whenever so lately, let me get the context. So recently what happened, I started getting a lot of patients, and then one thing I started looking at the common, which like whenever I ask them like, hey, how's the pain, and then they said, oh, it's getting worse, or whatever it is, right? People who say it's getting good, no problem with that. But people who say the worst, the one common thing I found out, and it was a stress. So it's funny, but whenever I ask them like, hey, what happened, can you tell me about it? It's like nothing, I'm fine, blah blah blah. After 5 to 10 minutes, they start talking about all the other drama going on in the family life, the financial issues, the kids not listening them, the parents giving them a trouble, the spouse is giving them a trouble, or this is not happy with that work. So it could be anything. And then it gives me an idea about this, like that's today's topic, because usually this is what I talk to my patients in general, and I have to give them like a proper education about that. And I thought that would be the perfect topic to talk today in live, and it may help you guys also to understand the how stress and the pain both are connected with each other. Because believe me or not, the stress make things worse. Most of you know already. I don't have to explain you that part, that whenever you are in a stress, everything seems bad. Like you're sad, you feel depressed, you're not happy, something, and sometimes that gives you more anxiety, angriness, like blah blah blah, all the stuff, right? And to be honest, that's the main killer aspect when it comes to the pain. And I have noticed that when I have a patient, and when patient comes to me and they said, oh, my pain become, it was like last week for 5 out of 10, and but today I feel like 10 out of 10. And there's two things I always blame it. They will blame it. One thing is the weather. So yes, every time it's gonna be cloudy, rainy, or something like, they'll say, oh, I feel it, my body feels it, which somewhat it's correct, and we'll have another day to discuss about it. But now the second most common topic is the stress. And even I ask my patients like, hey, tell me you're in stress. It's like, oh, how do you know? I'm like, because you just told me your pain got worse. So couple of things. Why you feel technically why you feel like a stress is affecting you more, and how stress can increase the pain, right? Now, to be honest, stress does not increase your pain. It's what you feel about it. Your pain is still same. So let's say your pain is 5 out of 10 level, from 1 to 10. The minute you are stressed, the same pain will become 9 or 10 out of 10. It's not that the pain intensity went higher all of a sudden. It's just because your body it's kind of under so much stress, like that causes tightness, stiffness, you can call it, like you stopping your blood circulation, so many factors involved, that makes that pain goes from 0 to almost like 10 in no time. And if you guys know this already, I think last time we discussed about the believing, right? Like if you missed my last live session, last week I did it one, was about the believing. So whenever you believe that you're gonna get better, it will automatically help you to get better. And two, if you missed it, just a little bit context I gave it to you. Like say you go to a doctor. A lot of time patients go to a doctor thinking that, hey, you know what? I don't think so this doctor gonna help me. I don't think so it's gonna work. I don't think so this medication gonna help me. I don't think so this cream gonna help me. I don't think so this exercise is going to help me. You keep telling yourself something is not going to help you. Now how can you expect that same thing going to help you when you keep telling yourself, I don't think so, nothing will help me. Now this is what it context the last week we discussed about it. So go ahead and look into it. I don't know how to do it, but I'll try to post it again if I missed the recording. But yeah, I think it stays in the live, so you guys can check it out, my previous live, and where we discuss about the how believing factor is most important when you're dealing with the pain. So I want you to have the positivity in your mind and your body, and that you will see the difference between the pain and the believing factor. And also you will see your pain going down, and you're getting all of a sudden everything started working. Your pain going down, you started feeling happy, you're getting strong, everything start making sense as long as you start believing it. So that was the last week, but this week, let's go back to the stress, right? The reason we talked about it again. So let's say how stress shows up in our body, right? The first thing is like very simple word, like I'll tell you just like that. So when you are stressed, right? Your body stressed up, like kind of a tense. So I don't know if you notice when you stress, automatically you go like this, right? So your shoulder goes up, your neck's kind of like tighten up and everything. Now what you do is this is our brain, right? There's a circulation going under the spinal cord, right? So it carries the circulation from brain all the way to throughout the body. The minute you tighten up, you kind of are stopping the circulation throughout the body, and you're making it more tight. That causes the neck pain, that causes shoulder stiffness, that causes the upper back slouching, the lower the confidence. It's so many disadvantage of doing that, right? So when you do that, when you are stressed, your body automatically gets tense. And the second thing is like it also, like your muscles start getting tighter, and like I explained, like it stops the circulation. Now because of the circulation, your nerves started compressing. So you feel like that, all of a sudden my hands started tingling, my legs started tingling. That's because when you stress, you're making your body stiff, and not just your body stiff, you're making your muscles stiff by doing that. And because of that, your nerves around the muscular and the bone area, it's also starting getting compressed. And whenever the nerves start getting compressed, you start feeling this tingling or numbness sensation wherever it travels. So for example, if something goes wrong in your neck, and then there's a numbness or say compression of the nerves around the neck and area, cervical area, automatically your hand starts getting numb, you start getting like a tingling and like a achiness, it starts getting. Then same thing with the lower back. But most when you are stressed, the main thing you will feel is like more, based on my experience, you feel it more like neck and the lower back pain is the worst thing ever. And not even that, and just because of that, every little movements, every little task start feeling like it's impossible to perform. So all of a sudden, from doing everything and not doing everything, and then negativity start kicked in, and you're like, oh no, I don't think so I can do that. Go back to the last week live, and it start messing up your joint pain, you're messing up your muscles pain. So you see how stress, just a little thing, not a little, of course, people under stress, they know how bad it is. But I'm saying that just because of the stress, your body gets tense, your muscles get tightens up. That helps, that drops the circulation, that makes your nerves more sensitive, and then all the movements or the tasks you've been performing all of a sudden start becoming impossible tasks, or it's a little bit like start getting pain. Like for so that's the one thing I really wanted to discuss about it. And the next thing is like common pains made worse by the stress. So for example, like I discussed, you get the neck stiffness. That's like a quite common, like automatically you start shrugging your shoulder, and you like, it's kind of a stiffening yourself because you don't want to move it. Either you're angry or you're stressed, whatever, because your mind is somewhere else, not watching how your body feels. So that's one thing. Also another thing I noticed is also give you sometimes a headache. Now headache has nothing to do with other factors. Maybe there are the multiple reasons for the headache, so yes, before you decide. But when you are stressed, right away you feel it like your head is starting heavy, like it's still you feel like, oh my god, it's like a pounding headache. Somebody's like like hammering your head, right? Or you want to hammer your head because of the you cannot take that pain. Now that happening because your neck is tightening up, like I said, because it's like kind of a stopping the circulation to your brain. Also it compressing all the nerves and causing this headache. So yes, I want you to check it out. But when you are in a stress and you get a headache, don't get panic. It's just mainly because you're stopping circulation and it compressing all the nerves. So that's why it's happening like that. Sometimes you get the TMJ joint, like all this like surrounded the head area, it just get tight, So sometimes you start like feeling like a ear problem or even dizziness because you're like stopping the blood flow, right? Can also cause the dizziness. So these are the symptoms. I'm telling you that when you have a stress, this is quite common. So you will feel it. So I don't want you to worry about or stress out too much because you already have enough stress. Now we don't want another stress about your dizziness. We don't want another stress about your headache. So I'm just giving you like a basic knowledge about like how stress and the pain is related with each other, right? So now let's keep moving. So that with saying that what you can do, like what you can do actually. So yes, we talked about how stress can affect your pain, like from how what are the areas like the symptoms you may see that might be because of the pain. So it's not necessary like you have a headache, but it's just because you have a stress that you have a temporary headache. Same thing with the tightness, same thing with the pain, like your pain is like 5 out of 10, but because of the stress, actually that 5 out of 10 pain will become like a 10 out of 10, and then you will go towards like a medication, shots, all kind of stuff, right? Now again, not necessary, you may not need it, depends. Again, talk to your therapist, talk to your doctors, and probably they will be able to guide you more, they will be able to help you more what exactly you need it. But this is more my job here is to kind of give you enough education so you know exactly what to do. Even you need to talk to your doctor, that you're gonna go to your doctor. So that's what I'm doing, everything I do here now. Okay. So first thing first, more whenever you are stressed, like don't think about it. Like I don't want you to think about the same problem again and again and again. Like let me give you a little bit context to it. So like let me tell you a little bit, I want to say story, but like little example, right? So think about a push pin. Let's take a push pin as an example. Like, so imagine you have a push pin, right? Either push pin go if either the push pin you hurt yourself or your hands or your leg go on a push pin. Guess what? Who's gonna get hurt? You, not the push pin, right? So same thing, when somebody hurts you, somebody does something, or you do to somebody, like and then there's a counter reaction to it, but at the end you are the one who's suffering, you are the one who's gonna go through this all kind of a problems, right? So what I want you to think about the push pin as an example, right? So when, let's say, you step on a push pin by mistake, or somebody is poking you with this push pin and you just like it pierced through your, let's say, hand, what you gonna do? Are you gonna keep the push pin there? Tell me if you're gonna keep there. I can guarantee you 100 out of 100 people will say no. Why? Because it hurts, right? Same thing is the stress. Think about the stress as similar as a push pin. Yes, it comes. You cannot avoid that. You cannot stop that. All of us actually have the similar issues. I do have a stress. Before I came to live, I had a stress whether what I'm gonna talk about, whether people will like it or not, if I'm gonna be able to helpful to the people, or it will be something meaningful, if my live will work, or if some technical issues will get like so much stress. But like at the end, I'm doing it. So I'm the guy who remove the push pin and just throw it away and then forget about push pin, right? So think about the push pin as an example, that whenever you get a stress, it's okay to get a stress, no problem, but the most important part is how you get rid of that push pin, how you get rid of that stress right away from your body, right? Now, I understand, like I said, it's not easy because there's so many factors involved when you are in stress, and there are a lot of times there are factors which are not in our hand, right? And there's nothing we can do about to solve that issues right away. It requires a lot of time. It requires a lot of other people's effort, right? But tell me about that. You can't control the situation, you can't control other people, but what you can control is your emotions, what you can control is your thought process, right? So I want you to think about as like, okay, I understand you are in a pain and you have a stress, so think about as like, okay, I want you to guys kind of come together, like, you kind of, put it your stress and that push pin I'm talking about, and just get rid of it. Say, okay, you know what? There's nothing I can do about it. I'm not going to think that for right now. I'm not telling you forget about it, but just let's push it away for a while, right? So that's what something really helpful. And usually I tell my patients as well, like, I know you want to help other people. I know you want to solve the problem. I know you want to do a lot of things, but start with one simple thing, which is take that push pin away, take the stress away from you and put it a little bit side for now, for 5 minutes, for 10 minutes, for hour. Do that. You know why you have to do that? Because that will give you a little bit breathing room. That will give you a little bit like a clarity on what else you need to do, how to focus on your body, how to focus on your pain, and how to take care of your own selves, right? So that's more important about you. So that's one thing. The second thing is start doing the breathing exercise. Breathing exercise is the best. I'm sure you heard thousands of times, a lot of people, a lot of different therapists, so many people always talk about breathing exercises, and there's a reason behind it, right? Because breathing exercises actually calms your nerves down, calms you down a little bit, right? So when you do the breathing exercises, I want you to inhale the air, hold it for count of 5 or 10 to start normally, and just take it out like a blowing a whistle. And every time you're blowing a whistle out, I want you to think about you blowing your stress out, and that's what it's gonna help you about, right? So try that, like, breathing exercise. Sometimes like a shaking your hair. So what you do is like kind of like, shrug your shoulders, like a shake your hand, kind of that. So it's just you taking that nervousness or anxiety out of your body. So when you shake like that, like a physically, like, you move your upper body, like, show your shoulder, like show your hands, like shake it, shake it, shake it. You can like do like a circle, like grip it. You can get the stress ball. I know there's a reason you do stress ball, because you squeeze it, you squeeze the anger out, you squeeze the stress out. That's what something you want to do it, right? So try different method, and I guarantee you it's gonna help you. But the first change is about that starts, it's with you guys, like, because if you're not ready, there's nobody can help you, right? So I want you to first think about, do you like pain? If you like pain, yes, go ahead and enjoy the stress, like no worries about it, right? But if you don't like pain, and then if you are in stress, the pain gonna go like 10 out of 10, right? So you need to do, or what you need to do is try to relieve the pain by taking the stress out, or like I said, push it away, put it on the back door for like today. All right, we're gonna discuss about tomorrow, we're gonna discuss about day after tomorrow, whatever it is. If somebody is giving you stress, say that, hey, do not talk to me today, we'll talk next week. Do not talk to me now, we'll talk other days. So that's what something you want to do about, right? Like, because yeah, you don't want to continuously take the stress and make pain worse. So yep, that's what something I wanted to discuss about it today. If you guys have any questions, you guys have any concerns, feel free to let me know. I'm here, like I said, I'm gonna be here for a while answering all your questions. Now we do have our Facebook private community, so if you are in a private community, you are allowed to even book the call with me, and you guys can come enjoy all the resources I share. Of course, I share with multiple, like, medias, but there's a lot of stuff I share only exclusively to our private community, and I'll be sharing more and more with private community. And like I said, the idea of going live is about helping people, and then if you submit any questions, I will personally make a video, or even we can go live on just like a Zoom call or something like that, and probably you guys give me more context, more ideas, more question, more like, like story behind your pain, or any issues you have, and I will be able to help more better. So right, so join my group if you want it. It's in the Facebook. If you go to my Theravio page, it's been there, so feel free to join that group if you need it. With saying that, I want to ask people, like, what pain gets worse when they're overwhelmed? Like, think about yourself. Like, it's all about like an active mindset, we call it, right? So I want you to start thinking about what are the area it's actually affecting you more pain. It's actually affecting you, and it's causing you more pain, right? So think about, I want you to start kind of putting in a two different bucket. Like one is a stress bucket and one is a pain bucket. So I want you to start actively noticing that, okay, your pain is like 5 out of 5, and then when you're stressed, now again, stress doesn't mean that there's something wrong, guys. Like, don't take me wrong, the stress could be overwork. Like, if you ask me, sometimes I get overwhelmed with the tasks. I need to take care of the family, I have to take care of the work, I have to take care of the business, my patients, the documentations, legalities, so much stuff, right? And it gets overwhelmed, and that caused a lot of issues on my body also. Like, I used to have a back pain. I just recently had my neck pain, just because I was so stressed about all these work related issues that I forgot about some stretching. So even I'm a therapist, and I also go through the same route what you guys go through it. So I'm not even it's not like that I don't get that. I'm in the same boat as you guys. So anything I talked about is it's personally I felt it, as well as I'm also seeing through my patient's eye, because I'm seeing my patients every day. Now, I'm not the therapist who just make the videos, guys. I'm 9 to 5, that's my job. I actually treat patient in the clinic, so I'm busy all day treating patient, talking to them. So whenever I'm talking to you, whenever I'm going to talk to you, this is going to I'm going to talk about it's about the pain and everything like that. So yes, that's what we talked about it. So okay, so now, if this helps, now I want to know more about, if you have any questions, if you have any particular, like, information you guys required, or any topic you guys want me to talk, like, feel free to comment, feel free to send me a DMs, feel free me to ask me any questions, and I'll try my best to cover it in a weekly live. Now, people who join the late again, or people who doesn't know, now we are going to this every week, and this will be live, absolutely live. I do not have any preparation, guys. I just come here, I hang out with you guys, I try to find a topic on my, like, weekday period, which I probably see which would be most beneficial for you. I'm planning to start a YouTube channel. I don't know yet, guys. I mean, it's a lot of work for me, because to start videos showing, because I feel like, yes, talking is really good, but then a lot of you guys probably want, like, show me exercises, show me stretching, show me some stuff which can really help you in your daily routine, or with something you can do daily life, right? So everyday life, I wanted to show you some of the exercise, I wanted to show you some of the stretching. And it's really hard to show it through the TikTok or YouTube, or TikTok or Facebook Live or kind of that. So what I'm going to do is, I'm planning, again, nothing concrete, but once I have like a concrete topics to discuss about, and I will create a videos, and it's include the exercises. Now, I don't know the format yet, I'm still working on it, but hopefully we'll have some sort of productivity by next week, or within this month. That's my target for this month. Okay, guys. All right, there you go. If this helps you guys, feel free to stress with your friends, family, anybody it could be help, your loved ones, your aunts, your uncles, anybody need help, I'm here for you guys. And my job is, like I said, to make 100 million people to live pain free, and I'll do everything and anything possible in my hand to achieve that goal before I die. And that's why I need to be healthy, and I'm taking care of myself, just because my goal is big, and I know I need to be healthy, and I need to be there for you, each and every one of you, with your pain-free journey. So yes, thanks for your support, thanks for your all the kind words throughout the live, people who commented, they get a great value out of it. I really appreciate for everybody, and I'll see you next week. Meanwhile, feel safe. Try to remember that example of the push pin I gave it to you. When push pin hurts you, all you need to do, just take it out. You don't keep the push pin in your body, right? So you have to take it out. Think about those think about that example, and then try to remove your stress from your daily life by doing like a simply breathing exercise, shake out your body. Yeah, you do like kind of stretching exercises, some kind of neck stretching, squeezing exercise, shrugging your shoulder, all those like a different techniques you can use it, whatever works for you. Some of you might be better with the breathing exercise, and some of you might be with the shaking exercises or activity, I would say. So choose the one works best for you. But most importantly, what I want you to guys do is not to take stress or push it down. Say, hey, see you tomorrow or day after tomorrow. So that's what it is. So with saying that, was great meeting you, everybody, and it's fun. I'm loving it, doing this. And I'll be back next week Friday. Sorry, maybe next week Monday at 7 o'clock. And we'll be talking some new topics, and hopefully I'll be able to bring some more knowledge to you guys, and I'll be able to bring some valuable information as well. All right, guys. Thank you. Take care.